Welcome to this explainer. If you're tuning in today, chances are you, or maybe someone you really care about, is dealing with a very specific, very frustrating kind of pain. I just want to start off by acknowledging how incredibly maddening it is to wake up one morning and find that your own arm literally refuses to move. It feels like your body has just locked you out of your own shoulder. Well, you're absolutely in the right place. Today we're going to unlock the mystery of what is actually happening to you, and much more importantly, how to fix it.
It really does feel like it just comes completely out of nowhere, doesn't it? One day you're totally fine, and the next, the simple act of putting on a t-shirt, combing your hair, or even just trying to reach that high shelf in the kitchen sends this sudden, sharp, breathtaking pain right through your shoulder. It basically transforms everyday life into an obstacle course. You're constantly guarding your arm, terrified of that next jolt of pain. We deeply empathize with that daily struggle. And through the information we put together today, we are going to show you exactly why that sharp pain is happening. So, here's our quick roadmap for this explainer. First, we'll cover understanding frozen shoulder, followed by Are you at risk? Then we'll break down the 3 stages, look at effective treatment options, and finally, dive into the recovery timeline and prevention.
All right, let's jump right into part 1, understanding frozen shoulder.
So the official medical term for a frozen shoulder is adhesive capsulitis, but let's actually break that jargon down for a second. Your shoulder joint is surrounded by this flexible, protective sac called a capsule. Normally, it expands and contracts, letting you move your arm pretty freely in almost any direction. But with this condition, that capsule becomes violently inflamed. It thickens up, and it develops rigid scar tissue. Imagine your shoulder joint being wrapped tightly in shrink-wrap plastic that completely physically traps the joint and prevents movement. That is why you literally cannot lift your arm. It's physically bound up.
Moving right along to section 2. Are you at risk?
If you happen to fall into the 40 to 60 age bracket, well, you're in the primary demographic for a frozen shoulder. It actually rarely strikes younger people. Plus, the statistics show that women are significantly more frequent victims of this condition than men. So if you're a woman in your 50s experiencing some mysterious shoulder stiffness, you are right in the bullseye of this condition's most common demographic.
But age and gender definitely aren't the whole story here. This might be a real aha moment for some of you. Having diabetes significantly increases your risk of developing a frozen shoulder. The exact same goes for thyroid disorders. Systemic issues in the body can actually trigger this localized inflammation in the shoulder capsule. Also, if you've recently had a shoulder injury, surgery, or even just kept your arm immobilized in a sling for a few weeks, that simple lack of movement can act as the catalyst that tells the capsule to start shrinking and scarring.
All right, section 3, the 3 stages.
Here is your chronological roadmap. And let's just manage some expectations right out of the gate here. This is not a quick fix. Stage 1 is the freezing stage. This lasts 2 to 9 months, where things just get progressively tighter and tighter. Stage 2 is the frozen stage, lasting 4 to 12 months, where the shoulder is pretty much locked in place. And stage 3 is the thawing stage, lasting 6 to 24 months, where the joint slowly opens back up. I know seeing timelines measured in months and years can be super daunting, but knowing exactly where you are on this timeline gives you the power to know exactly what comes next.
Now, what's actually really fascinating here is how your pain and your stiffness operate on completely different schedules. Take a look at that frozen stage in the middle. Your stiffness is literally at its absolute worst. You can barely budge. But notice the pain? The pain actually begins to decrease slightly. This is such a massive comfort to so many patients. Even though your shoulder feels entirely stuck, that drop in pain is your body's way of signaling that the aggressive inflammation is finally burning out and the true healing journey has officially begun.
Which brings us to section 4, effective treatment options. We really like to approach treatment through a logical escalation of care. Step 1 focuses entirely on just getting you comfortable. We're talking over-the-counter pain relievers, anti-inflammatories, and rotating ice and heat. Once that pain is manageable, then you move to step 2, physical therapy. And I want to heavily emphasize here that the vast majority of people will fully recover by staying strictly on steps 1 and 2. Step 3, medical intervention, is rarely needed if you're diligent with those first 2 steps.
So the crucial point is summarized perfectly right here. Consistency is far more important than intensity. Seriously, when your shoulder is locked up, your instinct might be to force it, to just push through the pain and aggressively rip that scar tissue apart. Do not do that. Aggressive stretching will trigger way more inflammation and actually make your symptoms much worse. Daily, gentle, patient practice is the true secret to coaxing that capsule to loosen up. It's a marathon, not a sprint.
So how exactly do we do that? Well, here's a really actionable checklist of daily home exercises.
Pendulum swings use gravity to gently open up the joint space. Finger walking up the wall slowly challenges your range of motion, millimeter by millimeter. Towel stretches gently work on your ability to reach behind your back. Incorporating these gentle stretches into your everyday routine is literally the single most effective way to breathe life back into your frozen shoulder.
Let's clearly contrast your options for a second. On one side, we have conservative care. This is your everyday, non-invasive home routine of stretches and basic pain management. On the other side are medical procedures. If your pain is just completely unbearable, a doctor might suggest a corticosteroid injection to forcefully calm the inflammation, or maybe hydrodilatation, where they literally pump sterile fluid into the joint to stretch the capsule from the inside out. But look at that very last point: surgery. Whether it's manipulation under anesthesia or cutting the capsule arthroscopically, surgery is strictly a last resort after months of unsuccessful conservative care.
All right, our final section, number 5, recovery timeline and prevention.
1 to 3 years. That is the total recovery journey for most patients. I know, that number can feel like a heavy, heavy weight when you're in the thick of the pain right now. But I really want you to view this timeline as a beacon of hope, not despair. It requires profound patience, yes, but the science is crystal clear. The vast majority of people who experience a frozen shoulder will eventually regain good, functional shoulder movement. Your body knows how to heal this. You just have to give it the time it needs.
And obviously, once you're healing, we want to keep you healed. So here are some proactive prevention tips. The absolute biggest takeaway: keep moving. Avoid prolonged immobilization of your shoulder whenever safely possible, especially after an injury or a surgery. Follow those rehab programs strictly. And remember that connection we talked about earlier? Managing your overall metabolic health, especially controlling your blood sugar if you have diabetes, directly protects your shoulder capsule from getting inflamed all over again.
Finally, we want to make sure you're empowered with some clear medical red flags. You absolutely do not have to just tough this out alone. If your shoulder pain lingers for more than a few weeks, if you physically cannot raise your arm, if the pain is robbing you of your sleep night after night, or if things are just getting worse despite your daily gentle stretching, it's time to see a doctor. Getting an early, accurate diagnosis from a medical professional dramatically improves your treatment outcomes and gets you on the right timeline immediately.
So, as we wrap up this explainer, I want to leave you with a question to think about. Are you ready to reclaim your movement and start your thawing stage? Yes, the journey is incredibly long. And yes, it requires consistency over intensity. But just remember the mechanics of what we learned today. It's just a tight capsule. And with patience, gentle care, and time, it will release. A pain-free, fully mobile shoulders waiting for you at the end of this road. Keep stretching gently, stay consistent, and we will catch you on the next explainer.